Hey everybody, this is Dr. Adi. Welcome to the channel, Cavity Free Kids. So I'm recording this video to teach you what actually happens at a children's dental office visit. I've been a pediatric dentist for coming up on almost 14 years now. And the reason I made this video specifically is because I want to kind of take the mystery and the scariness out of the dental visit, especially if it's your first time. You can even sit down and watch this with your kids if you'd like, and we'll kind of break it down and walk you through what happens when you go to a dental office, a children's dental office. So if the idea of taking your child to the dentist makes you anxious, you are not alone, but hopefully you will get some clarity on the whole process after watching this video, and it'll put your mind at ease. So I'm going to walk you through exactly what happens, everything from routine checkups to common treatments that we do in the office. So like I said, the reason I know a lot about this topic is because I've got well over a decade of treating thousands of children in my practice, everything from a child's first visit through treating adolescents. And my goal is always to keep kids comfortable, to make them confident and cavity free. So I'm going to help you do the same. So what inspired me to make this video was a recent interaction that I had with a patient where a mom told me, she used this phrase, she said, "I'm more nervous than he is." So, she'd grown up with painful dental experiences and assumed it would be the same for her child. And then after the visit, she said, I'm really surprised at how calm and easy and smooth that was. In my experience, most visits are calm and easy and smooth, despite what most people think about the pediatric dental profession. Most kids do fine. We keep things really chill in the office, and most people do great. Pediatric dentistry today is completely different from what most parents remember back in the day. So we're going to go over what happens at a routine preventative visit, talk about x-rays, fluoride, cleanings, and sealants. We'll talk about why some kids need additional treatment, in addition to basic checkups. And I'll go over the most common dental procedures for kids, and also at the end, we'll tie it all up with what you can do to reduce the amount of treatment that your child needs. So the first thing is the routine visit. So a typical healthy visit is going to include just a basic exam of the teeth and gums. We'll check your child's growth and their bite, evaluate their bite, ask you about any oral habits that they have, like pacifier use, thumb sucking, things like that. We'll assess their cavity risk and talk to you about that, and then we'll just do a gentle cleaning. It's called a prophy. So a good pediatric dental visit feels more like a wellness check than a medical procedure. So the first thing that I want to cover is x-rays. X-rays are the type of x-rays that we use in the dental office are a low dose, low radiation dose digital x-rays, super low dose radiation. I'll probably make a separate video discussing this topic because I'm aware of the controversy surrounding radiation around dental x-rays. We only use them when they're clinically needed, and they're really important for detecting cavities in between teeth. So, I can do an exam and look at a tooth and tell whether there's a cavity on the chewing surface, but if there's anything going on underneath the gums and between the teeth, the only way to detect that is with an x-ray. So it's super important to take them at various intervals depending on your child's situation. And x-rays are the best way to prevent big problems by catching issues early. So basically we use x-rays to see what the eyes can't and avoid surprises later. The next thing I want to cover, which happens in the first visit, is fluoride and in some cases sealants. So these are two preventive measures that we have to basically give us the best chance of your child either not ever developing cavities or stopping early cavities in their tracks. So the type of fluoride that we use at your child's exam visit is topical fluoride. It's painted on in seconds, it strengthens the enamel, and it reduces cavity risk by 30 to 40%. So it's not a treatment, it's like armor for the tooth. It strengthens the tooth and it reduces the vulnerability the tooth naturally has to acid attack. It just makes the tooth a lot stronger. And then sealants are a little bit different. They are an actual protective coating that we paint on usually permanent molars to shield the deep grooves from cavities. So if you look at a molar tooth in your mouth, you'll see that there are cracks and grooves along the chewing surface. What a sealant does is it basically fills those grooves. It's like a smooth varnish that we dry and harden on the tooth. What I tell kids is they're like little raincoats for the molars. They protect the chewing surfaces of the teeth. So these are two of the best preventive tools that we have in our arsenal. They're completely painless, and I usually recommend it to all of my patients, and most dental offices will do the same. Something that I want to address before I go on is that should your child have a cavity, before I get into the ways that we treat cavities, but if you find yourself in a dental office and surprised to find out that your child has a cavity that needs to be treated, I want to make it abundantly clear that cavities are not a parenting failure. There's a lot of factors that go into whether and why a child gets a cavity. Genetics matter, tooth anatomy matters, the shape of the tooth, saliva composition is different in every child. But diet and sugar frequency play a huge role. So it's not that genetics don't matter, it's just that we have a lot of leverage with diet and hygiene to prevent cavities from happening. So it's a combination of biology and habits, and we'll talk more about that later. So the first and most common treatment, dental treatment that some kids need, and I'm sure you're familiar with, is the classic filling, dental fillings. So basically what happens when you get a filling is the decay is removed, the tooth structure that's now missing is restored, and basically we're trying to preserve as much of the natural tooth structure as possible. It's really fast, it's effective, and usually the way that I treat most small cavities is with dental filling. So basically we're repairing damage before it spreads. The next most common treatment in pediatric dentistry is something called a stainless steel crown. So a crown is basically a full coverage restoration that goes over the tooth like a cap. And we do stainless steel crown restorations in situations where a cavity is too big to restore with a filling. In some cases, if the decay has entered the nerve of the tooth, we have to remove a lot of tooth structure in order to restore the tooth, and a filling is just not going to cut it in that situation. It's going to they tend to fall out if they're too big, break, they're not as durable, and the stainless steel crown holds the remaining healthy tooth structure together. So it's used when the decay is extensive. They're extremely durable, and they protect the tooth until it naturally falls out. So a tooth with a stainless steel crown will fall out on its own, just like normal tooth. Like I said before, doing a crown in a situation with a big cavity prevents repeat fillings. I have parents sometimes that try to insist that I restore a tooth with a filling, and I tend to stick to my guns with my clinical decisions for how to restore my patient's teeth. But I've been in situations before where I have acquiesced and done a large filling, and I've had to do repeat fillings multiple times, and it's not fair to the child to put them through a situation where they're getting continual dental treatment over and over again for a large cavity when we could have just put a cap on the tooth. So crowns save teeth that otherwise would be lost. The next treatment that's also fairly common is something called a pulpotomy, and that's basically a nerve treatment. Sometimes some dental offices will call them baby tooth root canals. They are nerve treatment, but I don't like to call them root canals because there's a lot of negative associations that people have with root canals. We're not going down into the canal system with files like you do in a traditional root canal. So really it's just a cleaning and disinfection and removal of the top part of the nerve inside of the tooth. It's used when decay reaches the nerve. It removes all of that infected soft tissue inside of the tooth, and it relieves pain and saves the tooth in many instances. It's not scary. It's pain relief and preservation. And teeth that receive pulpotomy treatments are usually crowned afterwards to keep the tooth intact. And then the last, and also one of the most common treatments in pediatric dentistry, is a tooth extraction. In some case, as a last resort, if a tooth is non-restorable, if the decay is basically too extensive, we have to pull the tooth. It's used for severe infection or unsavable teeth, and often it's paired with a space maintainer. So if a child loses a tooth early, we have to place a space maintainer in that area to preserve the space. Sometimes removing a tooth saves everything else around it. So in those situations, we kind of got to do what we got to do. It's not any more painful than any other dental procedure. We make sure everything's anesthetized in the area and usually get the child through without any issues whatsoever. It's a fairly common treatment in pediatric dentistry. So basically, things to keep in mind in a nutshell. If you're consistently brushing and flossing your kids' teeth, you're making smart snack choices, which I'll get into in another video. You're going to your regular dental visits to catch issues early intervention is super important, and you're avoiding, with really young children, bedtime milk after brushing or bedtime snacking after brushing. You're going to avoid a lot of these treatments that I just described. So the earlier we intervene, the simpler and cheaper everything becomes. So just to wrap up, a child's dental visit should never feel mysterious or scary. And when parents understand what's happening, kids feel safer and outcomes are better. So if you can prepare your child, if you are aware of what's going to happen, a lot of times it'll put your mind at ease and your vibe around the whole visit will transfer to your kid. So it's super important for you to be informed about what's going on and also to let your kids know what's up so that they know what to expect. Pediatric dentistry today is gentle, it's preventive, and it's focused on keeping kids healthy, confident, and smiling. And if you would like to dive a little deeper into all this this stuff. Everything I teach families in my office, I compiled into this ebook. It covers brushing routines, snack choices, and exactly how to protect baby teeth from day one. I have it linked in the channel description. You can check that out if you'd like, and I will see you in the next video. Thanks.